Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today's programming is must-see television, so please don't change the channel at this time because this is a life-enhancing and changing event. The program tonight is on grieving, the grieving process, and the sense of loss in one's life. These things are going to occur and have occurred to each and every one of us. The magnitude that these events play in our lives are variable from stifling to transitional during the course of our lives. And this is something that I've wanted to do for a very long time. When I first started to want to do it was my father had passed on about 10 years ago. And when he died, I was astonished that I was almost devoid of emotion for about a month after he died. He had a series of strokes and was in a state of decline, and it was inevitable that that was going to happen. But I felt nothing. And I was feeling bad because I felt nothing. And you know, like, why don't I have any emotion in me? What's the matter with me that I'm not a good son or that I wasn't appreciative of his life? And then about a month or two later, I would break out into spontaneous crying over his passing. And I would have a series of emotional expunging process go on. And this process went on for about a year before I reached a new equilibrium or a peace in myself about this sense of loss. Many families have had multiple traumas, multiple senses of loss and hurdles to get over. We're going to talk today just not alone on death and dying, but the sense of loss associated with one's marriage, a relationship, the loss of a job, very similar to, like we have a pyramid of life of things that we need, where we have air, water, food, shelter. Well, on the psychological pyramid of life, when we're talking about sense of loss or bereavement, is that there is an actual structural sense that we go through that's very similar to death and to the loss associated with death and dying. To be with me here today, I'm pleased to bring with us Dr. Susan Arlen. She's a physician in Bridgewater, New Jersey. She has, before I went on the air today, I was given a 4-page list of her educational requirements and history and her curriculum vitae. It is astonishing. She's a medical doctor. She has degrees and certificates in psychopharmacology and psychology. Her focus is on loss and grieving as far as the psychological aspect of her practice goes. She originally got interested in this work from doing rehabilitative medicine. Through that, she realized that these people who have these sense of physical losses went through a grieving process very similar to death and dying. From that, her studies went on to realize that there is a whole mental, psychological side associated with physical and as well as other losses in life, and her practice was started from there. She's also trained with Elizabeth Kubler-Ross, a pioneer in the practice of loss and death and dying and grieving. She is a woman who set up the parameters for our understanding of these senses of loss, and she has worked with her closely over the years and has been authored many books and articles on the topic. Dr. Arlen, welcome with us here today.
Thank you, Dr. Golding. I'm delighted to be here.
And I really looked forward to you coming for a long time. And could you tell us, so we'll first start out with loss associated with one's dying. Now, give us a sense of the processes that we'd be going through. I realize that there's not necessarily a right or wrong, but that people would go through.
Well, I think the most important thing is there isn't a right or wrong.
Okay.
And one of the important things that you brought up in your own experience is feeling numb. So very many people, when they first get a diagnosis of a life-threatening illness, or when a loved one does, become numb. It's not true. Something's wrong. We'll change it. It's just not right. Then people bargain, as I started to say. People look for answers, try to change things. Then things go back and forth. Numbness comes in. I want to go back to numbness.
Okay.
Because numbness is probably the most protective of all the phases of bereavement. Numbness makes us, or we make us, not able to feel, not because we don't care, but because we care so much, and we are protecting ourselves unconsciously from the pain, from the disabling pain. The numbness will fade bit by bit, and we will recognize the loss or the diagnosis or the impending loss as we are able to process it. The numbness can come back because as we reach deeper and deeper levels of understanding of what's really going on, our minds can snap shut to protect us.
Okay. So numb can be good.
Numb is good.
Okay. It allows for things to filter up in a digestible manner.
Yes.
Is that part of what that's about?
That is it.
So is there a point at which, let's say, a person is catatonic or in that state I mean, we know that there's not necessarily a right or wrong as far as time-wise goes, but let's say a person is fixated in this state of numbness, or goes so far as to additionally self-medicate themselves into, because when you said that, when you were talking about numbness as I feel numb as a self-protection thing, I immediately thought of people, drinking or self-medicating just to, because they want to feel numb. They don't want to feel pain. They don't want to come to emotional grips. Is there a point where that is, let's say you need to encourage that state of numbness to go into a next state or something else, or?
Well, certainly if somebody is self-medicating themselves, and interestingly, you're touching on one of the most important things that I usually end my speeches with is beware of self-medication. And people do that throughout life. Whenever there's a crisis, there are certain people that do self-medicate. When there is a loss, there is a tendency among certain people to self-medicate. When that happens, I urge anyone who is hearing this to see their doctor, because
it's like they're in limbo, right? They're never going to get any better, and they might get worse. And
they're not moving. Yeah. And we must move in life. And there are ways that you can get beyond the pain, that you must get beyond the pain in order to grow, in order to assimilate it into your person and become who you are going to be. Loss changes us. very often we cling to who we thought we were. Very often the change is imperceptible, but it gives us a greater recognition of our own humanness. If numbness goes on for more than, I would say, a year, I think it would be a good idea to talk to somebody.
Okay.
There are groups, there are therapists, there are wonderful books out there. The problem is when somebody is numb and is in denial, they're not going to pick up a book or pick up a phone. They don't think they need help.
Right. So encouragement from friends or family, if they see that, or
notice
they're
it.
just they're observing. Possibly people should take heed to what concerned loved ones might be saying.
I think concerned family and friends are very important. Another thing I've seen, instead of feeling numb, people make themselves very busy.
Okay.
So they don't have time to feel anything.
I've seen that before. I've seen that. I've had patients in the past that have had bad, like loss of a child for one reason or another, and the wife sought help. The husband sought to immerse themselves in work, which I mean was about as counterproductive to the process. She got better, they got distant, and he was just you get a wreck. So
it's very unfortunate. It's common after loss of a child that people can become distanced in their marriage, and that it can lead to divorce. So it is important to recognize that people mourning the same person will mourn differently, will grieve differently, and will need different things. And it's important to recognize that because you are behaving a certain way does not mean your spouse will. Just as important, people need to make a conscious effort, and it's so hard when you feel so immobilized. People need to make a conscious effort to reach out to each other, husband and wife, and even put into words, I miss the child. I don't feel exactly the way you do, but I want to be there for you as much as I can be. Yeah. And just a hand. Grieving people have very little energy, and when it's taking all your energy to just function...
Right, just to go to day in and day out activity.
Yeah, it's very, very hard to reach out, but people need to know that the loss can be geometrically compounded by the loss of the marriage and by feeling alone, which you're going to feel after a loss anyway, and isolated. So even a touch, even a pat, even a...
Yeah, it's similar to what we were talking about on the drive over here, is that if we're going to struggling together is better than struggling alone.
Yes.
And I think certainly in times of that kind of loss that would be good. In preparing for today, I do you find in your clinical practice that there is a difference between, let's say, acute loss of a loved one, sudden death, versus a gradual, terminal decline, where it's becoming more and more evident that the end is an eventuality? Is the grieving process what is the same? It's still similar. It's even though you see it coming.
That is the most frequent question that I have been asked when I've spoken. Whenever I've spoken, that is the most frequent question, and that's the question my patients ask most. And when I was writing magazine articles and people wrote and asked me questions, that is it. And it's very hard to quantify and qualify, because grief is different for each human being. It's like a fingerprint. And it hurts. And I would not want to minimize the pain of one person and say, well, that person's pain is worse or more severe. What I will say is that if you have preparation, if you can say goodbye in a gradual way,
and express your feelings of both good and bad and regrets of things, and
yes,
wishing things were slightly different, or
yes,
that is cathartic in advance.
It is cathartic. It is healing. It is. It's called anticipatory grief, and it's the grieving the dying person and the family or loved ones do ahead of time. And it is a time, I would urge people to seize the opportunity if they have it, and not keep secrets from each other, but be honest and say I love you. Say, I forgive you for whatever. Say, I wish we could have done thus and such, but we did this. And
right. Not just necessarily stressing the negatives, or
No.
Bringing the balance,
right.
The balance in.
And it's also important it's important for two people. It's important for the dying person. We've all heard stories, and I've seen things happen where when a family member that a dying person is worried about says to the dying person, I'm going to be all right, the person dies. So it's important for them, but it's important for the griever. I always urge people, if you have the opportunity to say something, to do something, do it now. Do it when you have the chance, because the biggest regret people have is, why didn't I say this? Why didn't I say that? And that brings in sudden death.
Yeah.
You don't get a chance to do any of that, or to even say goodbye, or to say I love you.
Do you find that people that have more of a repressed emotional ability to verbalize their feelings, whether, because I see a lot of times it runs in families. Certain families I know are very loquacious. I mean, everything's right out there. And they say as they, put it there, and then others are, more reserved, can't, they've got all of these, no, we're not like that. We don't do this. I mean, do you find that one might have more difficulty in the grieving process than another group, or not necessarily? Or?
If a certain lifestyle, or that's not lifestyle, but a certain emotional style has been your emotional lifestyle, you're going to handle loss the way you've handled life. However, again, I urge people to try to get in touch with, if not your own feelings, read about someone else's. Go to a bereavement support group and don't say a word. When I run these groups, I say you don't have to say anything. Just listen. Yeah. And even people with repressed emotions will hear other people saying what they may be feeling, and what that does is make them feel normal. And grieving people can feel very crazy.
Yeah. Is there a lot written? I mean, we talked about something that was unbeknownst to me, anticipatory grief, and that was, I guess that's the technical term for what I was talking about in advance, when you kind of can see the writing on the wall that there's, as I mentioned before, I never know anybody that made it out of life alive. But another observation that I was making for myself, and this is just strictly in the context of parents, is that in trying to understand the loss of a parent, I wasn't thinking just about the fact that they weren't there anymore, and that you may have that they're physically not there, but I was thinking that they're the only thing that has been continuous throughout the course of a child's life. The only single thing, the only thing that's always been there. So when they're not, it's got to have some type of deep set destabilizing thing, like the floors come out a little bit. The only thing that's a constant is no longer a constant. I mean, is that something that's been ever brought up, or?
That has been brought up, and it's interesting that parents in an intact family are the ones who will always love you and always accept you and hopefully always tell you the truth. When they go, when the second parent goes, who's the next one to go? Interestingly, we were talking about Billy Crystal before, and Billy Crystal said something that we in the bereavement community have been saying, I said in speeches for years. Adult people in their 40s, 50s, 60s saying, I'm an orphan. And people thinking, that's weird. Orphans are little kids.
Yeah.
An orphan is someone who does not have living parents. And yes, it is so much more tragic. I don't want to minimize that when you're a little kid. When you're an adult, it's very sad also. And there is the missing illusion that there's always someone there you can go to.
Right.
Because as our parents...
You can go home.
You can go home.
You can always go home.
Right.
You're always welcome.
Right.
Welcome at home.
Right.
Just saying that brings to mind how important good parenting is, and how important having good communication with your kids is, because if they can't get the truth from you at home, what do we have to hold on to? What do you have to as a sounding board? That type of thing. We hear frequently about, or you see frequently, one of the spouse dies, that they're older, and then the other spouse will die soon thereafter, and then there's the thought that they died of grief. And I was reading that there's actual studies that indicate that the immune system is diminished in the grieving spouse after the other spouse, has died, that there's a diminished immune response. Is that, I'm sure you've...
This is another important thing. Okay. You're bringing out all the important things. Fortunately, for your patients and people watching this, grieving is a very, very, very energy-consuming thing, whether you're numb or not, whether you're feeling it or not. And because it takes so much energy, Freud said we're born with only a certain amount of energy, and if you use it up, what's left to replenish? We need rest, we need nutrition, we need good medical care, we need good care of ourselves so that we can keep our immune systems going. Because during my residency, one of the things that got me into bereavement is that I saw a lot of people with physical disabilities in rehab medicine, loss. And so often after that, the spouse got sick, the caregiver got sick. So one of the things I started in my residency was talking to the spouse. And we started, several women started several years ago, a group called Caregivers at Risk, and the Well Spouse Foundation, to keep
them strong,
yes,
keep them intact,
and to help boost the immune system.
Yeah, it seems like such a vital part to keep that all together. To not drift off topic too much, but we're mentioning the fact that there's other losses that you study, that are not just dealing with death and dying, but then are like people have losses associated with their relationship and like the marriage and a feeling of grief, with all of that. It seems like grieving is an emotion that is such an energy sapping emotion that quantitatively it sucks a lot out of you.
It can zap you, and it can cut your feet off. However, you can also grow through it. And if you recognize that even good things, buying a brand new house, going into a brand new marriage, means giving up being a little kid living in an apartment. I mean, I'm comparing apples and oranges here, but all growth has loss associated. All life change has loss associated. People lose jobs, lose marriages, lose the illusion that they're going to be young forever. But each stage, each occurrence is an opportunity to care for yourself, to learn about yourself, and to grow.
Yeah. So a period for a lot of introspection and self-examination. Is that a part of the process that you go through with your patients?
When a patient comes to me, generally that means that they are interested in looking at themselves, in introspection, in
resolution of the issue.
I used to try to make it very simple and say, you have to know there's a problem first. So the first thing is recognition that there's a problem, and then you can work on it and then resolve it. And that's how bereavement works. You have to realize, and when I say realize, I don't mean, oh yeah, I mean we know up here something happened. You have to realize here, in your heart and in your emotions, and then work on it in your way.
I told you that would be good. Dr. Arlen, thank you for coming on the show today.
Thank you, Dr. Golding.
For Natural Healthcare Alternative, I'm Dr. James R. Golding, and we'll see you next time.